The Oxford Journey is a standing hoist which helps to bring a patient into a standing position from a seated position. To power on the hoist, the red emergency stop button must be released. The handset allows you to move the hoist up and down. The legs of the Journey are opened and closed using the foot pedals, and the brakes are located on each caster wheel. The height of the hoist can be altered by moving the blue trigger and rotating the cow horn up or down. Mostly this stays at a medium setting. The knee pad is height adjusted by lifting the blue lever and lowering or raising the knee pad as required. It is then locked in position by putting the lever back down. The emergency lowering lever is pulled up manually, allowing you to lower a patient onto a chair or bed without battery power. The battery itself is removed from the hoist and taken to a charging point for regular charging. Lolar checks must be carried out for the Oxford Journey and the sling harness before each use. Check the label on the sling and look out for any signs of wear and tear in its fabric and at the loops. The hoist itself needs checking. Check the battery is charged. Check the handset works, raising and lowering. Check the emergency stop button works. And check the emergency lowering works, and a general visual check for any signs of damage. Encourage the patient to lean forward and place the sling harness around their back at waist level. Gently adjust the waist belt as necessary and fasten the buckle at the front. Bring the Oxford Journey towards the patient, opening the legs to go round the chair. Ask the patient to put their feet onto the foot plate and rest their knees against the knee pad. Adjust the knee pad as required. There is no need to apply brakes. Attach the appropriate loops on the harness, as detailed in the patient's care plan, to the spreader bar. Ask the patient to hold on to the hand grips, keeping their arms outside of the sling. Raise the patient up slightly, then recheck all the sling's attachments and that it is safe. Raise the Oxford Journey to where the patient is comfortable, encouraging them to lean back. Move the Oxford Journey, closing the legs of the hoist towards the second seat. Open the legs of the Journey to fit around the chair. And then lower the patient over the centre of the chair, encouraging them to push their hips back in to get a good seated position. Detach the loops and remove the Oxford Journey. Ask the patient to take their feet off the footplate and then remove the sling. The Oxford Journey must be used with a patient who is able to weight bear and follow instructions. Any changes which could affect the patient's ability to use the hoist safely must be reported.